and welcome to Talkin Telehealth. I'm Erika Grau.
And I'm Kathy Ford.
Telehealth is having a dramatic impact on the way patient care is being delivered. On our show, we'll examine how telehealth can simplify communication, improve office workflow, and most importantly, drive better patient care. In addition to hearing some great clinical stories about telehealth in practice, we'll talk about where telehealth is today and where it's going, including how the latest regulations are impacting provider operations and reimbursement. You can find podcasts of previous episodes of Talkin Telehealth on our program page at healthcarenowradio.com and Rhinogram.com. Be sure to follow us on Twitter at #TalkinTelehealth and follow us at Rhinogram on Twitter. Welcome everyone to our very first episode of Talkin Telehealth. We are so excited for all of you guys to be here with us.
Let me introduce Rhinogram to our listeners. So Rhinogram is a leader in cloud-based, HIPAA-compliant telehealth communications, whereby we connect patients, clinicians, and office staff through confidential text-based interactions. Our company's telehealth platform, which supports multimedia messaging and Facebook Messenger, seamlessly integrates with most EHRs and synchronizes secure, encrypted patient communication into those clinical workflows. With Rhinogram, providers and staff can better engage with their patients by streamlining administrative processes, managing those pre- and post-procedure care, and reducing unnecessary appointments to realize value-based care success and deliver a quality experience that drives patient loyalty. We are based here in Chattanooga. This company was founded by Dr. Keith Dressler, who is a 34-year practicing orthodontist and a serial entrepreneur. Rhinogram is actually his third company that he has started. Let me tell you a little bit about me. I've been on the commercial side of healthcare IT for over 24 years now. Most of my years have been leading large multinational product management teams, and over those years have commercialized many significant solutions that today are actually saving lives and improving the healthcare experience. I joined Rhinogram because of a shared mission with our founder. I said, let's really solve some issues in this space, not just create another widget out there. Access to care and cost of care are huge issues we face. I love this solution because it actually positively impacts those two huge problems. And I am the president and the chief product officer at Rhinogram. Joining me at Rhinogram is our director of marketing, Erika Grau. Interesting fact about Erika Grau is that this is actually our second healthcare company that Erika and I have been a part of together. Erika has quickly become an industry authority on many of the current trends in our space, especially around ambulatory care and patient experience topics.
And Kathy won't tell you this herself, but she was actually named part of Becker's 102 Women to Know in Healthcare IT this year. She shares this list with the likes of Judy Faulkner and other accomplished women in this space. So let's go ahead and jump right in. So Kathy, it seems like every week there's a new change in regulation or update happening in telehealth. What do you think is behind this?
It's really a great question. There are so many things behind it, but let's focus on maybe the top three that are really major drivers right now in this space. My top three would start with physician shortage and access to care, sort of bookends between the physician and the patient and the challenges that exist between those two elements. My second would have to be consumerism. Consumerism is now expected. It is in healthcare. It's here to stay. And there are a number of really recent things that are happening here that I believe are important to telehealth. And then my third for today would be reimbursement. You can't leave money out of the conversation, and it certainly is important in this conversation. So let's dive a little bit into reimbursement and talk about what that means for telehealth and where we are today.
Okay, so first things first, let's talk about physician shortage. Honestly, we could probably have a podcast on this topic alone.
No doubt. Well, I mean, let's run through a couple numbers to get grounded. So what CMS is predicting, and honestly, over the last couple of years, watching CMS, continue to predict, which is, important for all of us. The numbers continue to rise, and they're not rising in small amounts. They're rising in tens of thousands of tranches. So what they're currently predicting, for example, is approximately 120,000 physicians short by 2030 in the U.S. And that number is focused around primary care physicians, so not even focused on specialists. That is a real issue. That is especially is going to affect and is already affecting our patients that live in rural areas of the U.S. So what does that mean? And if you're in the rural area of the U.S., by the way, what we know is you're probably traveling on average 17 miles to get to your nearest hospital. That, when we talk about access to care, that is a real emergency. For many people living in those rural health areas, if you think about a tank of gas, and if you're traveling 17 miles and it's round trip, you could be looking at a $25, $30 fuel bill, for a month of hospital visits. That, for some people, could be a choice that they're unwilling to make based on other needs that they have. So we can't ignore the fact that we have to be looking at other options in order to help close this gap in healthcare, because it's a real problem. So what does that mean? Well, there are technologies today like the telephone that gives people access to their provider or clinical staff or a office. That is, if you're able to get to a phone during office hours or practice hours, which are typically 9 to 5 or 9 to 4 with an hour off at lunch. And that practice has time to take that call and answer your question or get you to a clinical staff when you need it. What we do know is how it really works is the following. Most of us have jobs that we actually cannot just get up from our workstation or from the factory line or wherever we may be, or the floor of a store, and go make a call and have a 20-minute phone call. It's just not reality. What is reality is that we have questions, we have non-acute issues that we basically need addressed, and that there are technologies that can support this. When we look at physician shortages, what are we going to do to close that gap? Well, we have to figure out how a physician can see more than one patient almost at the same time. Well, how do we do that? Certainly the phone isn't going to be a way that we can do that. Video is probably not going to be the way that we do that largely, because again, of confidentiality and HIPAA and just personal preference, I think plays a role in that. So what does that mean, especially when you look at multiple patients almost at the same time? Well, it's using something like a texting or asynchronous technology where you can be essentially having multiple conversations at the same time, but still privately and, of course, in a HIPAA compliant way. This is really what we have to be looking at in order to look at the shortage issue. And then when you look at, again, the other bookend that we talk about, which is the access to care and, how far away people may need to travel, oftentimes what we also know is over 30% of the US does not have access to the internet. And so what does that mean? If those people cannot log into a patient portal to have a conversation with their doctor or ask a question and hope that they'll answer it back in some reasonable amount of time. So what does that mean? But just about everybody has a phone. Almost every American has a smartphone, in fact, and cellular service is still widely available and continues to do so and be so. And so what do we all use on our cellular networks? We text, and which is asynchronous communication. We text everybody in our lives, and that's, if we look at where we need to be to match how we live our lives, that's one of them, which really kind of takes me into my second topic.
So you mentioned consumerism as one of the drivers for growth of telehealth. That reminds me of this article that I just read, that Walmart is actually rolling out some standalone clinics, meaning the same place that people buy milk and their groceries would be the same place that they would get care. Do you find that this is like an example of consumerism and, today?
I think it's an important step forward. It'll be interesting for us to watch. We've seen CVS try to do and grow into doing something similar with their minute clinics. But when I look at it, what I see is a provider organization, being Walmart in this situation, trying to provide care where the patient is, and that is when they're at Walmart, which makes sense. What's missing in the strategy is what happens when they're not at Walmart, and how do they stay connected to those Walmart physicians and services. When you look at, kind of taking a step back, what is consumerism? I mean, what I want to say is consumerism, I believe, is the single biggest disruptor in healthcare right now. And I think it will be actually for quite a while. And really, that's thanks to Amazon and Uber and the rest that have really trained us all, and we've all become accustomed to getting what we want, when we want it, how we want it, and where we want it, and and don't have to compromise on any of those aspects. So why would we compromise in our healthcare? And the reality of breaking down consumerism, it really is just the notion of encouraging or promoting the purchase of services and goods. And that's what healthcare is about. Consumerism today in healthcare is telling us that patients want to receive care where they are, and where patients are at home. Certainly not sitting in a doctor's office or going to a hospital. And again, especially if you have quite a distance to go to get to that hospital. So the reality is that convenience wins. I mean, I think about, why do I use Amazon like I do? I live in Chattanooga. I certainly have access to big box stores. I can certainly go to those stores, and some are open 24 hours a day. But I don't, largely because everything is at my fingertips on my phone. I get notifications when something has shipped to me, and it's very convenient. So I can spend my time doing other things. And that is the reality of where healthcare is at, and why consumerism is a huge driver around the expectation to receive care where the patient is versus where the provider always is.
If you're just tuning in, you're listening to Talkin Telehealth with Kathy Ford and Erika Grau. This episode has been brought to you by Rhinogram, a leader in cloud-based HIPAA-compliant telehealth communications that connects patients, clinicians, and office administrators through confidential text-based interactions in real time. We were just discussing some of the reasons why telehealth has seen such recent growth. My next question for you, Kathy, is it's great that patients want it when they want it, where they want it, but what is the motivator for the provider organization to simply text with their patients or their staff?
Yeah, it's a real paradigm shift, no doubt about it. So care has been for, the last, over 100 years plus, has been the patient comes to the provider, and now we're talking about essentially the provider coming to the patient, but using virtual technologies to do so. So the great news is that 29 states today are reimbursing for all three modalities of telehealth. So that is real time, which translates to video, that is asynchronous, which are things like email and text, and then remote patient monitoring, which is a combination of these things based on a certain type of care situation. So 29 states today, and the predictions are that within the next 2 years or before that we will have all 50 states in line with that approach. In addition to that, when you get into the details of reimbursement and the complexities of reimbursement, which there's no shortage of those, we are pleased to see that payers, and based on state regulations, are also now supporting parity and partial parity of payment for telehealth exams or telehealth consults across those three modalities, again, depending on the state that you're in. This is really great news because it is certainly encouraging the provider to deliver care in the most convenient and effective way versus having to worry or focus on whether there's a gap in reimbursement or something not being fully leveraged from a provider and profit and payment perspective, which of course it all matters. So seeing that kind of parity and expansion is very exciting and encouraging. We saw tremendous movement in this space when CMS announced in 18 for 2019, starting in January, additional codes around the three modalities of telehealth for reimbursement. And they have already announced even more codes for 2020, expanding service lines and some of the parameters that go with that. So I encourage you to look into those codes, and in future podcasts, I'm certain that we will go into some of the details of those because it's rather complex from a navigation perspective. But what I see is every year now we're expanding, and there is a lot of momentum, and it seems on a very regular basis, each state is continuing to expand their own regulations in support of leveraging technology to deliver care where the patient is and address the needs. What I think about actually most recently, there was an announcement in early August, by the governor of New Hampshire. If you've not seen it or read it, I encourage you to look that up. He basically signed a new law expanding the scope of telehealth services covered, of course, under Medicaid, allowing the primary care providers and pediatrician to use connected health services, including all three modalities. And so that is really opening the door for all of the primary care physicians and pediatricians to be able to reach their patients. Of course, this governor has also said in other statements they're dealing with a rural health population issue. They need to close those gaps, and is making a bold move to really demonstrate, I think, to the country that leveraging technology rather than running from technology is what's going to service his patient population. What I think is certainly can't be left out of the conversation around reimbursement naturally is the continued adoption of value-based care reimbursement plans. And the reality around value-based care, as we know, or the simple part of value-based care is essentially keep your patients healthy and you will make money. So how do you keep patients healthy? We all know it certainly involves staying engaged with your patients. And again, if your patients don't have the ability to get to the phone on a regular basis, or especially if they can't get to an office visit for a checkup to check on their blood pressure or their blood sugar, or any of these things that they can also monitor at home, if you require a patient to come in, then you're probably going to have a pretty low patient engagement. But by leveraging technologies like asynchronous platforms where a patient can text back and forth with their clinical staff on their statuses, on their progress, on their concerns, on their issues, then you've got an engaged patient, especially if it's convenient, it doesn't interrupt their day, it doesn't affect their job. And this is really the progressive way to be thinking about reimbursement, especially if you're in a value-based care or at-risk program within your health system or within your practice. Maybe the last thing I would say about reimbursement, at least right now, is there was a report that was out recently that, states that, an office can save $100 per visit when you utilize telehealth technologies. So I mention this because this is really more of a public service announcement to the payer organizations out there that to continue to forge ahead and be open-minded around leveraging technologies, not bringing patients into an office for routine exams or for really low acuity issues that can be addressed through communication, and especially through convenient communication, meaning asynchronous or texting technology that is HIPAA compliant.
What a great initial dive in our very, very first episode of Talkin' Telehealth. We are so excited to tackle more aspects of telehealth and bring you great thought leaders in this space every month. And we are actually very excited about our next podcast.
Our next podcast, we will be fresh off of the National MGMA show. We are so excited because this national show this year is going to be taking place in the Big Easy, also known as New Orleans. So we are looking forward to seeing and hearing about the conversations taking place about telehealth. There are several sessions that are focused around this topic, which is terrific. I'm also looking forward to talking to other thought leaders in our industry about the challenges around adoption, reimbursement, technologies, and then also to understand trends and see who else is out there and what is happening. So way more to come on that, but it's going to be a good one. Don't miss it.
Can't wait. If you are going to be at this year's MGMA and want to talk telehealth with us, come by the Rhinogram booth. It's number 1023. We look forward to seeing you there. Thank you for joining our first episode of Talkin' Telehealth, recorded at Rhinogram headquarters in beautiful Chattanooga, Tennessee. You can learn more about Talkin' Telehealth on the show's program page at healthcarenowradio.com or on rhinogram.com. Find us on iTunes under Healthcare Now Radio, or tune in Monday through Friday and listen through your smart speaker by asking, "Play Healthcare Now Radio." And be sure to connect with Rhinogram on Twitter, Facebook, and LinkedIn. We'd love to hear from you. And remember, if it's in the world of telehealth, we're talking about it.